Hello everyone, my name is Robert Faulkner and I'll be hosting today's webinar. I'm a research and policy analyst within the Social Policy and Health Research Division with the School of Public Policy, University of Calgary. Thank you all for joining us today. The School of Public Policy is Canada's leading policy school known for our practical research and for bringing people together to discuss important issues with experts, which is what we're here to do today. I am pleased to welcome you to a series of webinars hosted by the School of Public Policy to provide expert commentary on issues that are impacting all of us on a daily basis. If you have to leave early, we post recordings of all our webinars on our website and YouTube channel, and you'll receive a link in the follow-up email. The topic of today's webinar is COVID-19, Civil Society and Social Responses. Our speaker today is Dr. Alina Turner. She leads Help Seeker, a B Corp social enterprise. Sorry, I lost my spot here, one moment. Our speaker today is Dr. Alina Turner. She leads Help Seeker, a B Corp social enterprise focused on scaling systems change to resolve complex social issues, leveraging research and technology. She is also a fellow at the University of Calgary School of Public Policy and is known for her work on systems planning and integration in the social safety net ecosystem. For our format today, Dr. Turner will take about 10 minutes to give a briefing on the issue. Then I'll open it up for audience Q&A. Please type your questions in the Q&A box below and I'll pose them to our speakers. I would now like to turn this presentation over to Dr. Turner.
Hello everyone, and thank you for joining us. We only have a little bit of time to give you an overview of what's going on from a civil society and social issues perspective. So to help me do that, I'm going to enlist the use of some stats to get us thinking about some of these challenges right now. So as you can obviously imagine, when it comes to major crises that the COVID pandemic represents, there's going to be accompanying social challenges that go along with it. And from our survey of about 100 communities across Canada, these have been the typical challenges that have been identified. So ranging from homelessness, unemployment, and then the expression of vulnerabilities in other segments of society that may have never needed to tap into the social safety net. So folks that may have been doing just fine that are now losing employment and therefore are challenged just in meeting their basic needs. And then of course the ensuing impacts of mental health and that come along with social isolation. And then especially for folks that are in environments where it's a long-term care facility, they're elderly, they're homeless, etc. You have this additional pressure from those environments. So those, of course, combine and go on top of each other to create further and further challenges that we may have not seen before COVID. The interesting things that we are seeing, however, are also the mobilization of civil society during this time. And what we're hoping to see more and more of is civil society taking a leading role in the social response to the pandemic. So while we have a pressure point on our health system right now, what we also know is that the social and the health and the economic are so interrelated. So everything we do to build capacity in civil society and leverage civil society is going to help us in terms of recovery long term. So why we want to think about civil society, number one, that it leverages a grassroots approach and usually mobilizes much quicker than institutional responses. And of course, it allows the more formalized systems to focus on higher levels of needs and to avoid some of the overwhelming of formal sectors as well. And then, of course, we're leveraging the non-traditional sources of funding and volunteer or HR power that informal groups tend to represent. So, of course, with that comes some potential cost savings or cost efficiencies, especially as funding is needed in other parts of the social safety net ecosystem. Finally, of course, that feature of civil society engaging in social issues gives us a sense of social cohesion and that we have some control over what's happening right now. And of course, those benefits of people feeling like they're being cared for by their neighbors and community. So with that, about about civil society, I wanted to just take a second to make the point that the way we have tended to think about civil society, especially from a policy perspective, has been primarily on the charitable profit sectors. But what civil society should entail in our policy thinking is also where social enterprises fit, where voluntary associations, natural supports, and informal supports fit in, because those are where we see some of this grassroots mobilization happening right now. And is our policy environment really conducive to encouraging that type of mobilization and leveraging what's happening naturally on the ground? So just a note that when we think about civil society, not to think of it too narrowly, because that's not what it's meant to be, is only the formalized sectors. However, there is something to be said about what we do know about the formalized sector. So right now, when we think about the social safety net, it primarily manifests in government provided social services or benefits, as well as contracted services in the nonprofit and charitable sector, and to some extent into the private sector, for instance, EAP, employment assistance programs. So when we try to analyze the breadth of the social safety net, we've got some limitations on data, but what is of interest is that there is considerable investments that government and donors have made prior to the pandemic. Yet that investment, and it's quite considerable, as you can see here, just charities. So remember, charities are only one part of civil society, but though just charities received about $280 billion in revenues in 2017. That's the most recent data we have available. 83 billion of that went to non-public charities. So these are more of the traditional kind of food banks and shelters, soup kitchens, that kind of rec and culture groups, etc., versus the big charities that are more reliant on governments. For instance, Alberta Health Services. I don't know if you knew this, but it's actually a charity. So under the CRA legislation, it reports as part of that $280 billion, which is why that number is so huge. But the point being with that is we've got that safety net there. How it manifests in terms of services is this huge and convoluted safety net of services, benefits, phone lines, all stacked on top of each other. And even before COVID, there's so much confusion about how exactly people are supposed to get the help that they need. So lots of duplication, yet lots of gaps. And of course, policymakers and system planners not knowing exactly what the pressure points are and where they should be making investments, because nobody can seem to understand and unravel this ecosystem to begin with. So that's something that hasn't changed because of COVID. If anything, it's getting amplified because governments are trying to react really quickly. And if you're putting additional investments on top of something that's quite convoluted to begin with, you're always running the risk of creating additional challenges for the end user, especially when you have so much duplication and gaps simultaneously. So that's another consideration for policymakers that are investing, for instance, in mental health and social services right now, is how is this going to play out at that user level when we know this is the situation at hand? And the other piece is, how are we already leveraging let's say the $83 billion that are already going into the safety net ecosystem that is independent of these major government services. So one of the ways to do that is to, of course, leverage data to inform decision making. And I'm using this as an example, but there's tons of great data sources right now that you're able to combine to get us a better sense of what's happening. So this is an example out of Alberta, and this is using the data set that I have access to, which is out of Help Seekers platform. So we know that obviously the interactions doubled just essentially in the last 2 weeks of March compared to February. So you can see there 45,000 interactions, which is double from February, and 18% were specifically around COVID. Now, look at how many listings exist in Alberta for civil society services, right? You've got 12,000 listings and 40,000 services. Now, what COVID has done is essentially rattle the cages on these services, because some of them have disappeared completely. Some of them are changing their hours of operations on an hourly basis. And then there's a whole new crop, as you can see here, 495 that are COVID specific that popped up just in the last 2 weeks. And these are, again, this data is now dead, because between when we designed it and today, these have changed again. So the real-time data is quite essential. And of course, the other piece to it is, how do we tie some of these investments and mobilization of civil society to actual needs that are happening in the community? And again, you can see here an example of the types of social needs that are emerging in Alberta, but I would argue there's obviously regional variation, but certainly some commonalities across Canada here. The big takeaway, of course, is that basic needs have popped, and mental health and addictions have popped up to the top of this list. And then when we mine further around COVID specifically, food is by far the most common, and then housing and financial supports as well as mental health are popping up as critical needs as well. So just to conclude and turn it over to you guys for further discussion and your questions, there continues to be a mismatch between the taxpayer donor investments and where Canadians tend to go for help. And that's primarily because natural supports, informal supports, friends and family is by far the most common source of assistance. Yet when we think about civil society, we tend to focus on this formalized charity, nonprofit, government sector. When we think about longer term recovery, we know we're going to have less money in the long game because of the economic impacts of this, and we certainly will have more problems. So less money, more problems. Governments are going to need to rapidly restructure investments and consider how making this current crisis-driven allocation is going to be impacting that longer-term restructuring needed. And yet there's hope, and civil society mobilization evidences this, that there is an opportunity for transformation and systems change towards a more agile and more innovative business model approach to addressing social needs in Canada. So the question is whether we're going to be taking advantage of that, or we're going to replicate the challenges and mistakes we've done thus far on convoluting the safety net for Canadians even further. So with that, I will turn it over to Q&As, and I believe, Robert, you're going to be helping us through that piece.
Yes, thank you. As mentioned, if you can type your questions in the QA box at the bottom of your screen, we'll take them as we see them. Okay, so Alina, first question. Is the role of civil society taken into consideration when lifting current rules of isolation, and if so, how?
So when we're lifting the current rules of isolation, or when we currently have them in place? Sorry, I didn't catch that.
Specifically when we're lifting the current rules of isolation, how does civil society play a role in the lifting, in the transition back to not a new normal, or to a new normal?
Yeah, no, for sure. And I guess we see some excellent examples of on the ground of how this is happening right now, with an eye to recovery already. So for instance, there's voluntary groups that have mobilized to connect with their membership and identify or screen in for well-being needs or well-being risks. So everybody has a connection. Like there's soccer clubs and sports clubs, etc. So these are traditionally not where we think of when we think about social issues. But I've seen so many examples of how these bodies have mobilized to connect to members and figure out essentially what's happening there, and identify and triage those members into higher levels of support. So that ability to kind of span the social safety net into the civil society organizations, that's something that can continue and should theoretically be a capacity that all of these organizations can continue to maintain post social isolation measures or quarantine measures that are currently in place. Like we should be having a cohesive civil society approach to social challenges regardless. So I think if we're smart, we're able to build that infrastructure now with an eye to recovery, and whatever we set up now, it shouldn't be this huge turn off, turn on. It should be a scaling approach. But lots of folks that are mobilizing may not know this, right? So who's leading the charge on system planning for civil society right now? And I think that's been a major gap that I've seen it across communities where some don't even have social responses to COVID. So hopefully that answered it, but I'm happy to dive in further as well.
Okay, next question. This is from one of our attendees, John Rosal. Agree with your view that there is a dizzying array of services out there. So how do we coordinate and rationalize these services? Is the role of government, donors, is this the role of government, donors, or can the nonprofit space develop a more cohesive support model?
That's a really, really great question. So the interesting part about that dizzying array of services, and if you're interested in further convos on that, there's some papers coming out from SPP on this in further detail. But what we have found out when you so-called follow the money is that this is primarily an investment made on behalf of taxpayers by the provincial governments when it comes to social services, because that's what we're talking about. And so, you know, if it is a diversity of ministries provincially that are making these investments, then it would make sense that those ministries and departments connect to one another to understand what one hand does versus the other. So for a really good examples on this, and just with the announcement this morning or yesterday around mental health and addictions in Alberta, mental health and addictions is actually funded primarily by the province. But interestingly, when you look at the money coming in, the Ministry of Community and Social Services funds slightly more, not much more, but slightly more than the Ministry of Health when it comes to mental health and addiction services and all. So here's a really good example of this ability to do a much better job integrating at that provincial level. But then obviously in the long run, you're going to need the philanthropic organizations as well to come into play. I am encouraged by some really innovative models that are coming out of the nonprofit sector that are actually looking at coalescing or condensing the sector and recognizing the duplication. So for instance, our friends at Boys and Girls Clubs in Calgary have recently worked with Aspen Community Services to combine those two organizations, recognizing that, you know, they're better together, and the taxpayer dollar and the donor dollar is going to go further, and they're going to be able to create some efficiencies on their administration side as well. So there are some really good examples of the nonprofit sector mobilizing to do things differently, because, you know, at the end of the day, we're going to have to figure this out, because we're going to be running out of funding with the economy looking the way it is. Government will have to be much more savvy, I guess, on their allocations. And if we can't even trace where the money is going and what the impact of that money is, then that means our decision making is going to be, you know, less than ideal, obviously, in a time when we absolutely need government to be very, very precise in their allocations. I can't hear you, Robert. You're muted.
Sorry, still getting used to this transition period. The questions are pouring in. We're going to try to get to all of them, but if we don't, we will certainly again post the video afterwards. And obviously, we'll be sending an email to Alina with the collected questions here.
Yeah.
So building off that, this is a question about metrics.
Yes.
Civil society, especially nonprofits, are usually an afterthought at best. One of the lacking aspects is an appreciation of the breadth and depth of such services and activities. How will this lack of metrics of the impact of those civil society be addressed at the federal or provincial levels?
That's a great question. So it's interesting, because this is the thrust of the conclusions in a paper I wrote on this exact topic. the challenge is that there are no consistent metrics on the KPIs or key performance indicators on civil society, social community impact, etc. Every ministry department funding stream tends to have its own shtick that they require through those funding agreements. Yet they should roll up at some point. So a really good example of how difficult this is, or the things we need to look at, is even if you look at ministerial business plans that have anything to do with the social realm. So justice, community social services, children's services, right there. We have them all over the country in some shape or form. Health as well. And if you look at the metrics that business units are measuring against, their investments against, and you put them together at a provincial level or federal level, they sometimes go against each other. So a really good example would be on homelessness. So a ministerial business plan that talks about efficiency and reducing dependency on welfare, that then creates rental difficulties in from a shelter core benefit perspective. So there's tons of those things that when you actually look at things as a whole, you realize that social policy needs to be a cross-ministerial job, and that all of these ministries have a role to play, and vice versa. Social policy has a role to play in the economy as well. So, you know, I've seen some really great examples of when it's not just the typical social services that come together to do this interministerial work, but you actually have economic diversification as part of those conversations, immigration and settlement as well, because they all are so interrelated. So I think some of the work that ministries are doing at the actual minister level, the political level, is really interesting. Now the trick is going to be trickling that down into administration and then reflecting that in the contracted services, because unfortunately that's where the difficulty comes in. The administrative untangling of years and years of this kind of scaffolded approach to the social safety net has to be rethought completely. Sorry, I could digress.
No problem, keep going. We're going to combine two questions here. They can really be summed up as, how do we, you know, somebody here agrees that civil societies have unique benefits, they can be quite nimble, but how do we avoid the trend of downloading government services onto voluntary organizations when they're not equipped to handle that? And two, how do we do that in a way that we don't increase redundancies or inefficiencies?
Fantastic. Oh, these are good questions. So then here's maybe it's controversial what I'm going to say, but this is me working in this sector for 20 years now and having been, you know, around the block as a client a few times myself. I feel that when I look at the history of charities and the social safety net actually in the Western world, we have already downloaded and privatized the social safety net. So while, like, stay with me, I'm not talking about making it you know, the typical kind of privatization. What I'm saying is the act of contracting services to another organization is a form of taking it out of government. So, and we've done that through a kind of a historical relationship between the state and the church back in the day. So we have a long history of doing business this way. The nonprofit charitable third sector is the most recent manifestation. And in fact, when we look historically at the rise of nonprofits and charities in Canada, while they've been around since, actually, as they were part of a pretty significant colonial project in Canada, but you actually see a major spike in the 1970s and 80s, which is coincidental, not coincidental, but it's definitely part of that downloading, that neoliberal approach to policy, et cetera, that we saw come into play. So it made sense to government at that time that this was the right way to go, with the premise that it was going to be more efficient than government providing the services themselves. However, in the process, rather than having this civil society concept where we have diversity of funding and lots of donors and lots of volunteerism, there's actually been a creation of dependence on government in our typical civil society organizations, to the tune of 80% of civil society in Canada receives its funding from government sources. So this whole concept that it's civil society is somehow apart from the state is challenged when we look at the contractual relationships between government and civil society. So to the point of, you know, how do we not further download the kind of financial truth of the matter is that we're already there. And now, however, we now have this opportunity, for better or worse, through COVID, where we have a new crop of civil society engagement in social issues that is not necessarily tied to the traditional nonprofit charitable sector. So how do we leverage that without kind of creating this, bringing them into this fold of dependency on government sources? So it's about capacity building, it's about community mobilization and grassroots, and the funding model for that is very, very different. I think there's a huge potential for B Corps and social enterprises. Obviously, I have a bias because I run a B Corp, which is somewhere between a government and private sector. But those types of approaches are, you know, could diversify civil society in Canada and to actually, you know, create some revenue streams that are independent of government, and maybe have some more innovative approaches to this work as well. So.
Okay, this next one. How do you recommend that grassroots organizations advocate about their actual needs versus their perceived needs according to government? And two, is that even the right level of at which advocacy should occur, or should it more occur at the individual level rather than the organizational level?
Mm-hmm. Yeah, that's almost depending on the type of what you're doing it for, right? So are you doing it to raise funds? Are you doing it to raise awareness about the issue? That's almost a marketing science kind of a question in terms of what your target audience should be for advocacy efforts. If I'm thinking about grassroots as well, there's also policy changes that are required and practice changes that are required as well. So what role do grassroots have in that work? I think social media and kind of the virtualization of democracy or digitization of democracy has an additional role to play here, because there is, you know, you now have a direct line to the public in a way that we might have not had before. So, you know, I guess it's a tough one to answer right off the top, not knowing what the exact issue is. The rule of thumb, though, is, you know, different strokes for different folks. However, you kind of want to tackle all of them at the same time, and each of them will have their own niche marketing strategies that tend to work better for lobbying efforts than others. So relationships are always critical: trust, legitimacy, evidence-informed. But I mean, you can call me after and I can tell you more about advocacy on your particular issue if that's of interest as well. So sorry, I couldn't be more specific on that.
No problem. Alina, we're going through quite a backlog here of questions, so we're going to stay on for a couple more minutes to tackle a few more.
Yeah. So, and I can stay on and keep answering, and folks can just, like, you know, leave as they need to as well. So and we can record, you know, what we'll do is record all my answers and we can send it out as well. So then at least we have it recorded, if that's okay, Robert. I don't know how many questions we have, but I don't know what I just signed up for.
We'll see how many we can get through here.
Okay.
Great. So next question is, are there any countries that are doing a good, that you can provide as a good example of meshing the social service sector and the government sector and larger society?
Interesting. So, I mean, you don't want to like point too much at like the Scandinavian countries. The UK has done a really interesting job of localizing responses and bringing in that social venture approach as well. And kind of diversifying what civil society looks like and what government's role is in convening and supporting civil society as well. So I would say the UK is an interesting one to look at. However, just like everything else, there's cautions to it, because of course you're going to find the arguments around downloading, that this is another way that government can download responsibility for the social safety net onto these other bodies. I totally get that. I'm an anthropologist. I have a degree in like their political economy, so I totally get that. At the same time, though, there is something to be said about agency and community organizing and mobilizing as well. So, you know, while we want to be critical of some of the downloading, we also want to be supportive of communities that are coming together and doing really interesting and good work. So yeah, I would just be, you know, cautious of all sides, or a little bit critical of all. One thing that the UK has experimented with, and I think this will be interesting for those of you looking at systems integration at the ministerial level, is that they've actually meshed, or have attempted, I should say, mesh their social services and health services. Now, the theory being that integration is going to lead to better efficiencies and outcomes. The weird part of that experiment was that when they did that, they added another layer of administration to do the integration. So it actually had this backfiring effect of creating worse outcomes for clients, longer wait times for service, poor well-being overall, etc. So that's a nut that's yet to be cracked. However, you know, we know from a person-centered policy and practice perspective, we need to go towards this holistic wraparound model. But I would say there's sporadic attempts at it that seem to have better results than the system-wide ones thus far. That doesn't mean that Canada can't do a really good job of it.
We're going to finish up here with two more questions. And again, that'll finish the formal Q&A session, and maybe Alina and I can go through a few more questions after that.
Sure.
The two questions more, I guess you could summarize them as a short-term question and a long-term question. The first one is, what is the role of civil society in contributing to pandemic policy development?
In getting into pandemic policy development? Is that
what is the role of civil society organizations in helping develop pandemic responses?
Oh, yeah. So that depends how well they are coordinated at the local level, I would say. So one tiny organization that has 5 volunteers compared to a kind of a national charity with millions of dollars budget. So, you know, in some of these situations, you kind of tend to pay to play, right? So if you have a big seat at the table because you're a funded organization or you're a funder, then you tend to be consulted naturally as decision makers are looking for expert opinions, etc. If you're a grassroots organization that doesn't have those connections, then obviously your role is going to be a little bit limited, and your expertise might not be in the policy realm. So I think the question should be, you know, how can government leverage civil society in their development of pandemic policy? And the way that they would obviously do this is to encourage coordinated approaches at the local level that flow up to provincially and nationally that are inclusive. So thinking about the diversity of the civil society sector, you know, don't just consult with the big charities. Consult also with the informal grassroots groups. Don't just consult with nonprofits, consult with social enterprises as well, and private sector organizations that are pitching into the effort. So I really want to, you know, point this out, because there's a lot of private sector work that, you know, we would totally bypass because it's private. Yet, like I said before, the line between private and public is very much blurred when it comes to contracted services especially from government as well. So.
Okay, we'll finish off with this one last question here. What opportunities do you see arising from this pandemic around conversations around the role of civil service society, and what conversations do you think need to happen around afterwards?
Yeah, like I was mentioning before, and in my presentation, the conversations I'm dying to have still is around exactly what this civil society thing is, because you know, we talk about it, yeah, we haven't defined it very well, and then when we tackle it in public policy or in allocations, etc., it's very much still traditional. So what I'm seeing though, and I'm really hopeful about, is that you have such mobilization happening at the grassroots level. And let's be honest, users, when we do a kind of a public survey and we ask people, where do you go for help? You know, just take a guess where they go. They go to informal supports. They go to their friends, family, number one. They go to their faith community. They go to their teachers, primary care physicians. It's a very much at the kind of bottom of the survey where they talk about the formal charitable and nonprofit sector, and that's okay, right? Because that's their role to tackle some of the more complex challenges. But then what are we doing to support the natural, informal, grassroots, voluntary supports that are, you know, part of that bigger, that are tackling the everyday challenges of Canadians? So I'm hoping that we're able to have those conversations about that the role of those more informal or grassroots supports in civil society, and ensuring that those interests are represented in public policy and funding as well. Oh, you're muted again.
Just realized that. Thank you, Dr. Turner, for providing your insight today, and to our audience for joining us. The School of Public Policy will be hosting regular webinars on a variety of topics, so please keep an eye on our website under events to sign up as they get confirmed. Our next will be happening on Tuesday, April 21st, and that will be on COVID-19 as a tool of information confrontation, Russia's approach. So come for some foreign policy analysis. Thank you again, and that's it for our formal Q&A session.
Awesome. So Robert, did you want to fire a couple more to me?
Yeah, well, we can do a few more here really quick. Sure. Okay, so this is from Dr. Ronald Kneebone. Any idea of how large civil society is in Canada versus elsewhere? Do other countries rely more or less on civil society than Canada?
Oh, Ron, he's just setting up for our next paper. That's a really interesting question. I actually did do some reading about it, and it's all over the place, right? So, and a lot of it has to do with development, like developed and underdeveloped nations, etc. So, for instance, in some countries, private donations make up bigger contributions to the social safety net than government itself. So, for instance, the Bill Gates Foundation, or Bill and Melinda Gates Foundation, I should say, is actually the biggest contributor to philanthropy globally, and even more so than any of the other ones put together. So we do have this interesting situation when we look at the reliance on civil society internationally, where it kind of begs the question of what the right mix is, right? Because if you, and comes to the other comment around performance metrics. So if you're not able to follow the money to outcomes, then you're adding on this additional layer of the funding sources, then it's really tough to say, for instance, is it better to invest more in, you know, this type of organization versus that? Or is it better for government to deliver the service themselves versus contracting it out? Because again, for Canada, we haven't done a good job of having transparency around outcomes. And even though we invest about more than 20%, I believe, of our GDP in the social safety net. So it's a considerable amount of money that we need to do a better job understanding the impact of for Canadians. So I think it's work to be done for sure. Ron, and I know Ron and I are looking at this issue across provinces, because even within provinces, there's huge variation in the sources of funding and where the funding is going. So yeah, work to be done for sure.
We'll take a big question and a small question. I shouldn't say a big question, small question. We'll take what we might consider a more individual case-by-case issue versus a more organizational issue. The first one here is the role of caregivers. Oftentimes these play hired, meaning they're working for a family, or informal caregivers. Oftentimes there's a bit of a tension and conflict point here, especially in hospitals, when the caregiver plays a very vital role in the well-being of the individual or family, but yet they're not recognized by a lot of facilities. As we move forward into future, whether it's future waves of pandemics or otherwise, how can civil society move forward with policies that recognize the role that caregivers are not simply visitors within these types of facilities?
Yeah, what a wonderful question. Yeah, so how do you do that? Well, I think it's also about the capacity building we need to do for citizens as them being critical parts of civil society, and us having the ability in our pandemic planning to think about civil society's role and preparing for it. Again, we tend to prepare hospitals, we tend to think about business continuity and for kind of essential services, but we don't tend to think about the role of natural supports or informal supports as part of our pandemic planning, which is why things like that happen, right? Where you have caregivers that are not necessarily part of the care plan when, arguably it matters most. So, and that's the same thing around food security, transportation, access, et cetera, where we have civil society mobilizing to aid, yet no formal channels for coordinating their responses. So for instance, Rotary Club connected with me yesterday. They've just sold thousands of homemade masks. They had no idea, how to get them out to end users. Yet what a wonderful opportunity to create a voluntary corps that can be mobilized in times of these types of challenge. So, and because you know what, we're always going to have something going on, right? We have the flood, we have the fires, we have various pandemic waves. So it's not going anywhere. So I just think the emergency preparedness plans and ECCs, or emergency command centers, should have pay attention in their pandemic plans to the role of civil society, and have guidelines and policies in place and training so when this occurs in the future.
Great. Unfortunately, Dr. Turner, you have to end it there, but we will send these emails. We'll send these to everybody in an email along with the questions, and hopefully we can get them answered. Again, we have a lot here about everything ranging from UBI to large federal and provincial organizing bodies, etc. And hopefully we'll be able to answer your questions, even if it's not during the process of the webinar. But thank you all for joining us for today. You have a good day, and we'll see you at our next webinar.
Thanks all. Bye.